Hey future nurses, welcome back to Scrub and Spoon. How are you all doing? Thank you for your support always, right? So today's Nclex review is on Nclex most tested drugs, right? So we are talking about lithium, Vancomycin, Albuterol, Enoxaparin, and Prednisone, okay? So I want you to watch till the end. Stay tuned, there's a lot to learn in this review. Watch till the end, subscribe, like, and leave in the comment section your best part of this review. Without wasting our time, let's go. Okay. Now, the first question. The nurse is caring for a patient on lithium therapy. Which of the following findings should the nurse report immediately? A. Fine hand tremors. B. Polyuria. C. Slurred speech. And D. Mild thirst. Guys, and the right answer, can you guess, is C, slurred speech. Now, let me explain it to you. Look at the list of choices you have. I need you to understand the difference between lithium side effect and lithium and signs and symptoms of lithium toxicity. Okay? Now, I know a lot of you might be thinking, okay, hand tremors, you see that in lithium, right? You see that as a side effect. And you see this at the therapeutic level of lithium. And you know, expected side effect, they are expected findings, right? They are not, hand tremor is not adverse effect. And that's why we did not choose, because I know you guys might be thinking about hand tremors, right? And slurred speech, right? So the right answer, like I said, is slurred speech. And why? Slurred speech is a neurological impairment. And it also includes, when you're saying slurred speech, you are saying ataxia, you are saying confusion. These are signs of lithium toxicity, and it needs to be reported immediately. Guys, I've always told you, when you have to report something, that means what you have to report is an unexpected findings, because if it is expected, there is no reason to report it. So what you have to, what the nurse have to report immediately is an unexpected findings, which is slurred speech. Once you are seeing slurred speech in patient taking lithium, signs of lithium toxicity. Now let's go through the wrong choices. Now, A, fine hand tremors. They are expected, like I have explained, because it is a side effect, not signs of lithium toxicity. So because what they're asking us is what you should be, the nurse should report. So since you know that fine hand tremor is expected, why should you report that? It's a side effect that is expected, so you do not have to report that. Polyuria. Now, with lithium have somewhat diuretic effect, right? Lithium can cause you to pee a lot, and that's why that's why when your patient is on lithium, you have to educate them to keep hydration on, to keep drinking water, to encourage fluids, okay? Because dehydration would also cause lithium toxicity. Because lithium, think about it, lithium causes frequent urination like polyuria. You are peeing a lot, right? So if you are peeing a lot and you are not drinking, you'll be dehydrated because you are losing so much fluid. So that's why when your patient is on lithium, they tell them to encourage fluids and prevent dehydration, avoid dehydration, because hydration will cause increased lithium toxicity. So it only makes sense that they are losing fluids, they are peeing a lot, encourage them to take a lot of water to avoid dehydration, right? Now, and the last one, mild thirst. Mild thirst is an expected side effect of lithium, not sign of toxicity. I need you guys to understand the difference between toxicity, signs of toxicity, and just the side effect of lithium. So mild thirst, fine hand tremors, and polyuria are expected side effect of lithium. The only sign of toxicity here is slurred speech. I hope I've been able to explain that. Now let's move on. A client taking lithium reports nausea, vomiting, and diarrhea. What is the nurse's next best action? A, hold the next dose and notify the provider. B, encourage fluid intake. C, administer antiemetics. And D, reassure the client that these are expected side effects. Guys, the right answer is A, hold the next dose and notify the provider. Now, hear me that I said hold the next dose and notify the healthcare provider. Remember, as the nurse, you are not the one that prescribed the medication. So you are not just holding, you are taking action. You are holding it and you are notifying the provider. And why are you holding it? Now, the signs and symptoms your patient is having, nausea, vomiting, diarrhea, are signs of lithium toxicity. So if they're already exhibiting all the signs that the lithium level is already high in their system, why should you give them more? Make it make sense. Why should you add to it? You have to hold it and look for interventions to reduce the level of lithium in their system, right? And that's why you are holding it. Now let's go through the wrong choices. Encourage fluid intake. I know you might be thinking about this because dehydration will cause lithium toxicity, but guys, they are already having kinds of toxicity already. So you can encourage fluids, but you are not treating what is causing the nausea and vomiting and diarrhea. And that's why we didn't choose encourage fluids. Yeah, they need fluids when they are on lithium because they can be dehydrated. Dehydration will cause lithium toxicity. But the signs and symptoms show that they're already in the state of toxicity, right? So what you have to do is to prevent further toxicity and prevent further complications. That's why encouraging fluid is not the best. It's good that actually after holding the medication, you encourage fluids. That's the next thing you should do, okay? Because they are vomiting, they're having diarrhea, and that can also lead to dehydration. So after you hold the medication, encourage fluid because they're losing fluids, okay? And now administer antiemetics. Now antiemetics are their medication that will prevent nausea, right? Now, if you should give them antiemetics, you are masking the symptoms. Now, let me explain to you. You give them a medication that will suppress nausea, right? Now, they are not having nausea, and you did not know that the lithium level in their body is already high. They are already at a state of toxicity because you've given them a medication that will mask the signs and symptoms that can indicate toxicity, so you know that they are in toxic state and intervene, right? So you already mask signs and symptoms or that indication that they are in lithium toxicity state. That's why that's not the right answer. Now, the last one, reassure the client that these are expected side effects. These are not expected side effects from everything I've explained to you. They are not. So that's wrong. Now, the next one. The nurse is reviewing a patient's lab results. Lithium level is 2.3. Which symptoms should the nurse expect? Select all that apply. Now, let's go to how do we treat select all that apply? We treat it as true or false. I know select all that apply can be challenging, especially when you're writing your exam on Nclex, because if you select 2 and get 1 wrong, that one you get wrong might be deducted from the 2, so you're actually just getting 1. It's a system with this new generation Nclex exam, right? Now, ataxia, yes. So what they are asking you now, look at the lithium level. The lithium level is 2.3. Normal lithium level is what? 0.6 to 1.2. Anything over 1.3 is toxic. Lithium toxicity. 2.3 is way above, is way high, right? They are in the state of toxicity. Now, ataxia, yes, this is a neurological sign of lithium toxicity. Now, muscle rigidity, absolutely, right? Fine tremors, absolutely not. Like I told you, fine tremor is a side effect, expected side effect at lithium therapeutic level. So fine tremor is a side effect, so it's wrong. Seizure, absolutely. And last one, nausea and vomiting, absolutely. So our answer is A, B, D, and E. The only one that is not right is fine tremors, okay? Now let's go. A patient is prescribed Enoxaparin. Which instruction should the nurse include in patient education? You will need weekly INR checks. Avoid taking aspirin or NSAIDs. C, administer the injection into deltoid muscle. And D, hold the injection site firmly for 5 minutes after administration. Now, your patient is taking Enoxaparin, and we are looking for the right instruction you should give your patient when they are taking Enoxaparin. Now, let's go through it. You will need weekly INR checks. Absolutely not. You do not need INR checks for Enoxaparin. You need INR check for warfarin, not Enoxaparin, okay? Avoid taking aspirin or NSAIDs. Absolutely, yes. Right? Now, let me tell you why the right answer is B, avoid taking aspirin or NSAIDs. Your patient is taking enoxaparin. And what is enoxaparin? Enoxaparin is an anticoagulant, a blood thinner, low molecular weight heparin. That is enoxaparin, right? Like I said, blood thinner, anticoagulant. If they should mix that with aspirin or NSAIDs, both aspirin and NSAIDs also poses risk of bleeding. Now they're already taking enoxaparin. If they should combine this, either of these two meds with enoxaparin, they'll be at highest or higher. They'll be at increased risk of bleeding, because when they are actually on enoxaparin, they're at risk of bleeding. So if they should combine aspirin or NSAIDs with enoxaparin, their highest, very high level of risk of bleeding. That's why they should not combine this medication with enoxaparin. Now let's go through C. Administer the injection into the deltoid muscle. Absolutely not. Enoxaparin is administered through subcutaneous tissue in the stomach. Okay, so not IM. And the last one, hold the injection site firmly for 5 minutes after administration. Absolutely not. You don't want to hold. You pinch when you want to inject the enoxaparin, but you don't hold for 5 minutes. You hold it briefly and that's it. 5 minutes is too long. Okay, 5 minutes is too long, so that is wrong. So our right answer here is avoid taking aspirin or NSAID. This is a good teaching. This is the teaching the nurse would have to include when they are educating a patient on enoxaparin. Avoid aspirin or NSAID because it poses greatest risk of bleeding with enoxaparin. Now let's go. Which lab value should the nurse monitor in clients receiving enoxaparin again? Okay, now INR, APTT, platelet count, and last ND, hematocrit only. Guys, run away or avoid any choices that has only. That is, you just know, cancel it out. Any choices that has those inclusive words, all, only, wrong. Okay, now let's go through it. And the right answer is C. The nurse should monitor the platelet count. Now the reason why the nurse should monitor platelet count is because the heparin this patient is taking can cause heparin-induced thrombocytopenia. I'll break it down to you. Now, thrombocytopenia means reduced blood platelet count. Reduced blood platelet count. And now you have to understand, what does platelet do? The platelet helps blood clots. Now they are taking enoxaparin that is thinning the blood, right? So now the platelet is not really doing its function anymore. It's not clotting the blood. And then because of the enoxaparin they are taking, the enoxaparin can be reduced the effects of the platelets. And that will lead to reduced platelet count. And that is what is referred to as thrombocytopenia. And that is why you need to monitor that when a patient is taking enoxaparin. Because enoxaparin can lead to heparin-induced thrombocytopenia, low blood platelet count. Platelets help blood clots. Okay? Now, let's go through the wrong choices. INR, like I've explained before, INR is for warfarin, and PTT also shows how long the blood clots, but it is not routinely monitored for for enoxaparin. I need you to know that enoxaparin is it's like a low, like I've explained, is low molecular weight heparin. Okay, and the last one, hematocrit only. Hematocrit is also useful, but it's not important as checking the platelet count when you are taking enoxaparin. Hematocrit helps you to know the count of red blood cell in the body. So it is not as important as checking platelet count, because now if they have very low platelet count, if your patient should bruise themselves or have any cut, the blood is not going to clot, because the clotting factor, what helps clotting in the body, in the blood, has been diminished, has been reduced to a zero level, very low level. So the blood is going to be very hard for the blood to clot. Okay, I hope I explained that well. Now let's go to next one. The nurse is teaching the patient about albuterol. Which of the following should be reported to the provider? A. Nervousness. B. Tachycardia. C. Palpitation. And D. Chest pain. Guys, look at the list of, even if you do not know what albuterol does. By the way, albuterol is a bronchodilator. It's a rescue inhaler. It is used first line of treatment during asthma attack. So, but look, even if you do not know what albuterol is used for, just look at the list of your option: nervousness, tachycardia, palpitation, chest pain. Which of this is the greatest red flag on this list? Chest pain. Chest pain. Chest pain is the greatest red flag. Now, chest pain is our answer. Why? Because patient taking albuterol complaining of chest pain may indicate cardiac ischemia or arrhythmias. Okay? And that should be reported. Cardiac ischemia is when there is not enough supply of blood and oxygen to the heart. That is very important. Let's go through the wrong choices. Nervousness. Nervousness is expected with albuterol. This is a mild central nervous system stimulation that can happen with albuterol. So it's not the first thing you want to report. Like I said, look at the list of the choices you have. Which is of the biggest red flag? Next one, tachycardia. Tachycardia is also expected with albuterol, because albuterol can stimulate beta-1 receptor in the heart, causing mild tachycardia. So it's somewhat expected. When you have to report palpitation, if it persists or it gets worse, then you have to report it. But as of right now, what we have on, according to the question, because do not add to the question, just look at what was given to you. Okay? That's why palpitation is wrong. It's not our right answer. Okay, now let's go into the next question. A nurse is administering Enoxaparin to a post-op client. Which action requires correction? Now we are looking for wrong action. Okay, now inject into the lateral abdominal wall for Enoxaparin. Now, pinching the skin during administration. C, massaging the site afterward to aid absorption. And D, avoid aspiration before injection. Okay, guys, like I said, we are looking for the wrong teaching or wrong action. The wrong action. So here is list of what you should do if you want to administer Enoxaparin, right? And an anticoagulant. Now the right answer, which is the wrong action to do, is C, massaging the site afterward to aid absorption. Now, I've explained earlier, you do not massage that site because you can cause bruising, increased risk of bleeding, or even tissue damage. So do not massage that site. You pinch. Now let's go through the wrong choices. Inject into the lateral abdominal wall. Absolutely. Subcutaneous. Enoxaparin is administered subcutaneously, right? That's good. Pinch the skin during administration. During administration, you hold the stomach fold to be able to inject, right? And for fast absorption too, easy absorption. And D, avoid aspiration before injection. Absolutely. We no longer aspirate. What this means is that when you inject the needle, you aspirate by pulling back the plunger to see if blood comes out. And if blood comes out, that shows you are in the blood vessel. We no longer do that. You don't aspirate anymore. Okay? So the only wrong action here is massaging the site afterward to aid absorption. You will cause tissue damage, you will cause bruising, you can cause bleeding. So do not massage the site. Okay? Let's go to the next one. A nurse administers albuterol to a child with asthma. Which action indicates the medication was effective? Okay? A, the child reports chest tightness. B, the child shows decreased wheezing. C, the child has an O2 of 87. And D, the child becomes drowsy. Now, we are looking for a sign that will show albuterol therapeutic effect. Okay? Now, the right answer is B. The child shows decreased wheezing. Albuterol, like I've explained, is a bronchodilator. It helps open the airway for easy breathing. Okay? And this way, a child that shows decreased wheezing, because wheezing is that sound you hear when the airway is closing up or tightening up during inhalation and exhalation. It shows they are having respiratory distress or having problem breathing when you are hearing wheezing. But now the wheezing is decreasing, so it's showing that albuterol they took is giving therapeutic effect. Now let's go through the wrong choices. The child reports chest tightness. Really? That is not showing therapeutic effect, so that is totally wrong. O2 drop 87. The child's O2 is supposed to be between 95 to 100. This is 87. This is not showing therapeutic effect of albuterol. And D, the child becomes drowsy. That's not showing therapeutic effect of albuterol, so that is wrong. Okay, let's move on. The nurse is reviewing vancomycin administration. Which of the following requires immediate intervention? A, the infusion is running over 90 minutes. B, the patient reports itching and flushing of the face. C, the patient's creatinine is 1.1. And D, throat level is 12 mcg. Right answer is B, the patient reports itching and flushing of the face. Now think about it. They are on vancomycin administration, right? The one that requires immediate intervention is the patient, when the patient reports itching and flushing of the face. Because what is this suggesting to you? This is suggesting red man syndrome. Look at the medication they are taking, vancomycin. And vancomycin, what causes red man syndrome with vancomycin is rapid infusion of vancomycin. If you infuse vancomycin too fast through the IV, it is administered IV slowly. So if you infuse it too fast, the patient may have signs and symptoms of red man syndrome, and that is when they have redness on the face, on the chest, on the neck, on the extremities, itchiness, and that's the signs and symptoms they are presented with here. And I need you to understand that red man syndrome, get this right for your Nclex. Red man syndrome, it is not side effect of vancomycin. It is as a result of fast infusion of vancomycin. So understand it. It is not side effect of vancomycin. It is caused because the vancomycin was infusing too fast, and that needs to be intervened to immediately. You need to slow the IV immediately. Okay, that's our right answer. Now let's go through the wrong choices. B is the one that needs intervention. Now A says the infusion is running over 90 minutes. That is actually good. Vancomycin is infused slowly over 60 minutes or 90 minutes, so that is good. Okay, now the patient creatinine is 1.1 within the normal range, so this does not need any intervention. Creatinine is 0.6 to 1.2. This is within the normal range, it's okay. And the D is a through level of 12 is still within the normal range. And what is through level? Through level is vancomycin concentration level in the blood, right? So, and the therapeutic range is 10 to 20, and this is through level here is 12 mcg, which is within the normal range. So the only one that needs intervention is B. The patient reports itching and flushing of the face because it suggests red man syndrome. Okay, what is the nurse's priority assessment for a patient receiving vancomycin and furosemide concurrently? Now, A, blood glucose. B, liver function. C, hearing acuity. And D, platelet count. The nurse's priority assessment when your patient is combining vancomycin and furosemide is, the answer is C, hearing acuity. Now, vancomycin is ototoxic, that is, It is very toxic to the ear. It can damage the ear, right? So as furosemide. So this combination can cause ototoxicity, okay? That is damage of the ear. So it should be, so ear acuity should be monitored. The nurse is administering prednisone. Which teaching should be included? Select all that apply. A, do not stop this medication abruptly. B, avoid people with infection. C, monitor for signs of low blood sugar. D, take with food to reduce GI upset. And E, this drug may cause weight loss. How do we treat select all that apply? We treat it as true or false. So let's go through it. Remember, they're taking prednisone, and this is corticosteroid, right? They are the stress hormone in the body, right? And also remember that corticosteroids or steroids suppresses the immune system, okay? Now let's go through this. Do not stop this medication abruptly. Absolutely, the nurse should include this in this teaching. In fact, do not stop any medication abruptly. We know that because it will cause exacerbation of the condition you're using it for. With prednisone, if you should stop it abruptly, it will cause adrenal crisis, right? And that's when you see signs and symptoms of Addison disease. Everything will be low, okay? Now, avoid people with infection. Absolutely. You know why? Steroids suppresses the immune system, so they are already immunocompromised. They are at greatest risk of infection. With long-term use of steroid can also cause slow wound healing because the immune system has been suppressed with steroids, corticosteroids, okay? Now, monitor for signs of low blood sugar. Absolutely not. In fact, you will see hyperglycemia, high blood sugar with prednisone, okay? Now, take with food to reduce GI upset. Sure, absolutely. Now, this drug may cause weight loss. No, this drug will cause weight gain. With long-term use of prednisone, they will have water weight, they will gain weight, and that's why you see the moon face. They will gain weight, so not weight loss, okay? So our right answer is A, B, D, okay? Now let's move on. The nurse is educating a client newly prescribed lithium. Which statement indicates a need for further teaching? We are looking for the wrong statements, okay? I will drink 2 to 3 liters of fluid daily. I can continue using ibuprofen for my headache. Now, I'll have regular blood work to check my lithium level. And D, I should report any signs of diarrhea and vomiting, right? The right answer, guys, the right answer here is B. I can continue using ibuprofen for my headache. You know why? Ibuprofen is NSAID. And people that are at greatest risk of lithium toxicity are people with kidney dysfunction. And NSAIDs can increase lithium toxicity. And that's why that is the wrong statement. NSAIDs can also increase lithium toxicity. Instead, encourage them to take acetaminophen, Tylenol, not NSAIDs. Now let's go through the wrong choices. The wrong choices are actually correct statements because we are looking for wrong statements, right? Now, A, I will drink 2 liters of fluid daily. Absolutely, they should encourage a patient to take between 1 to 3 liters daily to keep hydration, because dehydration will cause lithium toxicity, increase lithium toxicity. So you want to encourage them to take fluids. You want to encourage hydration. That is right statement. I'll have regular blood work to check my lithium levels. Absolutely. You check the lithium level to know if you're at the therapeutic range. Absolutely. And I should report any signs of diarrhea and vomiting, because these are any signs of lithium toxicity. So you have to report that. Okay. So our wrong the statement that need further teaching is taking NSAID. Instead of taking NSAID, take acetaminophen, because NSAID will increase lithium toxicity. Now let's move on. A nurse is preparing to administer a morning dose of prednisone. Which assessment finding is most concerning? A, blood glucose of 186. B, weight gain of 2 pounds in 2 days. C, white blood cell count of 14,000. And D, temperature of 38.8. Guys, remember everything I've said about prednisone and be able to pick the right answer. And the right answer, guys, is D, temperature. What is that suggesting to you? Infection. Remember I told you prednisone suppresses the immune system. And if you look at the remaining options or choices, they are expected side effect of taking long-term use of prednisone or corticosteroids. Blood glucose of 166 is expected. Hyperglycemia happen with prednisone. Weight gain, water weight. I told you that they will gain weight, or they can gain weight with long-term use of steroids. And C, white blood cell count of 14,000. Now, mild leukocytosis is expected due to demargination. But the last one, temperature of 38, is very concerning because it's suggesting infection, because they are already immunocompromised, being on steroid for a long time or taking prednisone. Okay, now let's go. The nurse teaches a client prescribe prednisone about dietary needs. Which food should the client include more of? Bananas, spinach, canned soup, all grains, and yogurt. Now we're talking about dietary education of a patient taking prednisone. Okay, now let's go through. This is select all that apply, so let's go through each choices. Now, bananas, absolutely they should take more bananas, because prednisone can cause hypokalemia because banana contain potassiums, right? Now, spinach, yes, because spinach will give them good potassium and calcium. They should be encouraged to take good spinach. Now, canned soup, absolutely not, because canned food they are high in sodium, and remember, sodium swells the body. They are on prednisone and they are already gaining weight, water weight. So you don't want to tell them to take canned food, because that contains salt and they will gain more. Their sodium swells the body. They will gain more weight, water weight. So no. Now, all grains is good because it supports bone health and reduce GI upset. That is good. And last thing, yogurt. Yogurt is good because yogurt contains calcium, and these can counteract bone loss, because when they are taking, another thing you need to know, that we're taking prednisone for a long time, you are at risk of osteoporosis, brittle bones. So them taking yogurt can help because it has calcium, and it can counteract the bone loss effect of prednisone. Okay, so the only food they would not be advised to eat is canned soup. Okay, now let's go. Which client's instruction is most appropriate when teaching about albuterol use? Now, A, use albuterol daily to prevent asthma attacks. B, I should wait 1 minute between each puff. And C, I must rinse my mouth after using albuterol. And D, if symptoms persist after one dose, I must wait 8 hours. Now, they are asking us appropriate teaching for albuterol administration. And the right answer is B, I should wait 1 minute between each puff, because this ensures medication delivery. After the puff one, they inhale the weight. 1 minute before next one. Okay, now let's go through the wrong choices. Use albuterol daily to prevent asthma attacks. Actually, no. Albuterol is not a maintenance dose, it's a rescue inhaler. So you use it during asthma attack to open the airway quickly. It works in minutes. It's a rescue inhaler. Okay, so that is wrong. Now, I must rinse my mouth after using albuterol. No, you rinse your mouth after using fluticasone, like steroids. So during asthma attack, the first thing is to take albuterol, which is the rescue inhaler, before steroid, like fluticasone. Okay. Now, if symptoms persist after one dose, I must wait 8 hours. No. After each puff, you wait 1 minute after each puff. And you can take up to 3 puffs within 20 minutes apart, not 8 hours. And it also depends on the provider's instruction. So you have to follow the prescriber, the healthcare provider order of your inhaler, your puff administration, but definitely not waiting 8 hours. Okay guys, we are almost at the end of this review. Okay, now let's go. A client taking lithium for bipolar disorder is found to have a serum lithium of 2.2. Which symptoms should the nurse expect? We are looking for signs of lithium toxicity because that lithium level is high. Now, A, blood vision, B, constipation, C, weight gain, and D, mild tremor. Guys, the right answer is blood vision. Because if you look at the list of options presented to you, blood vision takes priority. This is one of the signs you will see with lithium toxicity. And blood vision suggests neurotoxicity. You see blood vision, confusion, ataxia. Those are neurotoxicity. Okay? Now let's go through constipation. No. If you want to see GI signs and symptoms of lithium toxicity, you will see diarrhea, not constipation. Does that make sense? Now, weight gain. Now, make it make sense. Weight gain may occur with lithium over time, taking long-term use of lithium over time. But weight gain will not will not be sign that you will see that your patient is at lithium toxicity state right away, because weight gain occurs with time. It's not an instant thing. It occurs with time. So that's why that's not right. And mild tremor, like I have been explaining to you guys, is side effect, not sign of toxicity. Side effect of lithium, and it occurs at therapeutic level. Okay, now let's go. And the very last one, guys, thank you so much for staying till the end. Do not forget to like, to subscribe, leave your best part of this review in the comment section, and I will be reading and replying. Thank you. Now the final question. Which client statement indicates proper understanding of albuterol use? I will use this inhaler daily even when I feel fine. I'll use this before exercise to prevent wheezing. C, this will cure my asthma permanently. And D, I should use this inhaler immediately after corticosteroid. Now guys, the right answer is B. I will use this before exercise to prevent wheezing. So we are looking for statements, correct statements that indicate proper understanding of albuterol. And why? The patient will use albuterol before exercise to prevent wheezing. Why? Because albuterol is commonly used before exertion. That is, albuterol is used before strenuous activities. Strenuous activity or strenuous exercise can lead to exercise-induced bronchospasm, right? So they use albuterol before strenuous activities to prevent narrowing or obstruction of the airway because they are doing strenuous activities or because they are exercising. So that's the correct statement. Now, let's go through the wrong choices. I will use this inhaler daily when I feel fine. Albuterol is not a maintenance dose. I've said it before. So it's used during asthma attack as per doctor's order. Okay? Now, this will cure my asthma permanently. Asthma is a chronic condition. It is not cured, it is managed. So this is a wrong statement. I should use this inhaler immediately after corticosteroid. Absolutely not. It is the other way. You use albuterol first before corticosteroid. You don't use corticosteroid before albuterol. Okay, guys? And that completes our review for today. Thank you.